Well, thank you. For those of you that don't know me, I'm Sherrie Spilde, and right now I'm the interim service area administrator for the Southeast Service Area with the Department of Health and Human Services. And can I just have a show of hands? How many of you have actually heard of alternative response? Woohoo! It's Friday afternoon. Maybe we can hurry through this presentation. We've been working on alternative response as an agency for about 2.5 years. And I have to, many of you know I've been with the department for a number of years, and I'm truly, in true disclosure, I can honestly say alternative response is one of the better, well-planned out initiatives that the department's been involved with for a number of years. We are very excited as an agency. This is almost, for some of us of my age or older, almost a look back at good old social work practices. So we're excited that we're going to be afforded the opportunity with alternative response to engage in families in a new and hopefully improved way that will help hopefully reduce the risk of future maltreatment for children in our communities. So, for those of you, we just talked about this. LB 553 was passed in the second legislative session this year. The bill provides for the ability to respond to reports of child abuse and neglect in two different distinct areas. There will be two tracks in coming through the hotline. One will be alternative track, and the other will be traditional response. And we'll talk a little bit more about them in a few minutes. But alternative response, in some states it's called differential response, is it's a movement across the nation. It has been proven in most states that have implemented and been fully implemented to really does help reduce the likelihood that children are entering into the system at more severe levels and suffering from more significant levels of, we call it risk of harm, but abuse and neglect. You can see from the map here, the states in purple, and I know it's kind of hard to read, but the states in purple are states that have fully implemented differential response or alternative response systems. The blue are states that have implemented it, but those are states that are also county-based states. Nebraska is a state-based state. And in those states, there has been some struggle to get consistency in practice across those counties in those states, but some of it have been very successful, and those are highlighted in blue. The green states, and Nebraska is one of them, until 17 days from now, we will turn into a purple state. Planning and considering. Like I said, we've been planning for about 2.5 years for alternative response in Nebraska. And October 1st will be implementation in 5 pilot sites across the state. And so, like I said, we'll start in 5 pilot sites, hoping to, at the end of our 5-year pilot, it is a 5-year pilot, to have the entire state doing alternative response. So, and then you can see there are actually some tribal jurisdictions in the nation that are using alternative response and have been quite successful with it. It's a nice pair with a lot of the philosophies of our Native American partners and their work with their families within their culture. What is alternative response? Alternative response, for those of you that don't know, is an additional approach to help families with less severe reports of child abuse and neglect to receive the services and supports that they need to keep them safe. Traditional response is an investigation to determine whether child abuse or neglect occurred, who is responsible, and who is responsible for the maltreatment. That's what we do today. That is when a call comes into the hotline. If it's determined to meet certain standards, workers are sent out, sometimes in conjunction with law enforcement. Law enforcement receives all the reports, and we do a traditional investigation where we go out initially, and we'll talk a little bit about this, and interview the child, hopefully the alleged victim, in a private face-to-face interview. Then we proceed with our interview protocol, which dictates that we talk to the siblings of that child, the non-offending caregiver, and then the alleged perpetrator. Response assignment. The assignment to alternative response or traditional response begins at the hotline. That doesn't change. The obligations for all citizens of the state of Nebraska to call the hotline has not changed. And that's where it begins. When the hotline gets called, they'll begin an application of the exclusionary criteria, and we'll talk about those in just a few minutes. Some families will be immediately signed to the local office and law enforcement for a traditional response. That won't change, and we'll talk about when it will change. Some families are referred to the, and we call it the red team, review, evaluate, and decide team for a secondary screening. The red team, and this probably isn't the order I necessarily would have put it in, but there are 21 exclusionary criteria, and they may be in a later slide, and I apologize, I gave another presentation using a different PowerPoint today, and they were a little bit in different order. There were 21 exclusionary criteria, and for those of you, many of whom may have been on the statewide external stakeholders, I see some familiar faces here, we had several leadership committees that were involved in the implementation, giving input and feedback to the department to help the alternative response legislation get passed, and then also to help with implementation. There's the Director's Steering Committee, there's the Children's Commission, there's an external stakeholders leadership meeting, and then there's actually an internal leadership meeting within the Department of Health and Human Services. It was decided based on feedback, very good feedback that was given by the external stakeholders meeting, which was comprised of a number of individuals, professional individuals across the state that had a vested interest in alternative response, to come up with a list of criteria that we wanted to have in place to address the cases that we felt needed to be worked in a traditional manner. So when a call comes into the hotline, the very first thing the hotline staff will do, will look at the 21 exclusionary criteria. If any of the information that is gleaned from that call meets any of those 21, we call them exclusionary criteria, those intakes will be accepted for traditional response. If, however, the information that's gathered in that initial call, none of the information meets those 21 exclusionary criteria, the hotline will then look at 6 additional criteria, and we call them the red team criteria. And they're going to look at this, they're going to review the severity of the allegation, the access of the perpetrator, the vulnerability of the child, history of previous reports, parental cooperation, parental caretaker factors, and then they will decide whether or not this particular family is more appropriate to go down the alternative response track, or does it really need to be a traditional response. Alternative versus traditional. If either approach, DSS assesses the risk of the situation. One of our major missions of our agency, and always has been and probably will always be, is we are charged with ensuring the safety of children. That does not change. Every time a worker makes contact, whether it's an alternative response or in a traditional response, the worker will be assessing the safety and risk of the child in that home. And they will be using the same tools they use. The alternative response workers will be using exactly the same tools that we use to assess that safety and risk. And that's in the department, it's our structured decision-making tools. If the child is in imminent danger, if it's an alternative response, the worker gets out there and there's a significant situation of safety concerns, that case will automatically switch to a traditional response. That worker that makes that initial contact will be the worker that will then proceed with completing the assessment in a traditional response manner. We're not going to switch workers in the midstream. That's not family friendly, and especially particularly when we're dealing with children who are victims. Law enforcement will receive, I think this has been a big concern, but law enforcement will be receiving all reports of coming from the hotline, whether they're traditional response or alternative response. Here you can just see it's kind of lined up the differences. Really, traditional response is focused on allegations that are more severe. It also labels perpetrators and victims. Alternative response are allegations that are less severe, and we are not necessarily, well, we're not labeling, we're going to use the labels caregiver and child. Law enforcement, if law enforcement becomes involved in any case, whether it's alternative response or traditional response, if a citation occurs, the case will actually switch to traditional response. Law enforcement is not going to be involved in alternative response, although, as I mentioned, we will be sharing all of our reports. The interview protocol, we talked about what it was like with a traditional response. The interview protocol, when workers are making contacts with families in alternative response, is different. We will be working with the family, we will be making contact, talking to the parents, and asking permission to visit with their child, asking for their suggestions on how to best approach the child. We're really going to be working on to fully engage that family. Now, there's been a lot of questions about this protocol, and what if the family doesn't give permission? Well, depending on the concern that's expressed in the intake, it's going to be the role of our workers to really work to get the families on board to let us talk to their children. But bottom line is, we have a responsibility to talk to those children, so we're going to get it accomplished within our standard timeframes, whatever way we can, even if it means, unfortunately, having to switch that case to a traditional track to get that done if we have to go to the school and interview the child privately face-to-face or make other arrangements to make contact with that family so we can interview them, because we still are charged with the job of ensuring safety, and we can't do that if we don't talk to these children. There is no allegation, therefore there's no finding on the central register. Allegations really on traditional response really we have to, as a department or an agency, evaluate whether or not we're going to make a central registry finding. In alternative response, there are no allegations, and that's one of the uniquenesses about alternative responses. Families won't have that on the central registry, and those of you that are familiar with the central registry, it can be quite cumbersome for families, because if they are put on the central register, it can really impact their ability to get jobs, secure employment. It can really hamper them in a lot of ways that a lot of these families that we are going to be working with an alternative response that makes a significant impact, because we know these families are families that are living in poverty. If they can't get a job because they're on the central registry, it's just creating more of a problem. Keeping in mind that these alternative response cases are really those cases that are less severe in nature, really related a lot to issues of poverty. In a traditional response, services are often provided after a thorough assessment. In alternative response, we want to be a little bit more proactive and not wait till we get all of our assessments done, although I can say even in traditional tracks, many times we're putting in services before our assessments are completed. But in alternative response, we want to, if that family appears to be on the brink of crisis and needs some additional supports, we want to be able to put a system in place where we can immediately address their needs. An example I could give is families on the brink of getting evicted because dad lost his job and they don't have the money to pay the rent, or maybe they haven't paid the rent for a couple months and now they're at the point of being evicted. We're putting in looking at different kinds of supports we can put in that family where we can help them with that rent assistance immediately. We can help them with that utility bill. We can help them with that car repair. Whatever it is that needs to be met to keep that family, get that family more stable and eliminate them from a situation or crisis that could result in heightening the risk in their family, the risk levels in their family, or even create a situation where maltreatment may occur. Families assigned to a traditional path have to stay in the traditional path. They can't say, whoop, wait, I hear about the great things about alternative response. I want to switch paths. There's no way they can go from traditional to alternative response. However, and actually when we've looked at research done in other states, occasionally there are times when families will want to go to a traditional response path for whatever reasons. In a lot of that, sometimes we see that other states have seen that in like divorce custody situations. They want to take a more formalized path. So it's the family's choice. If they wanted to switch to traditional, we will switch to traditional at the family's request. So that's somewhat unique, and there's been some questions about that, but that's when we've looked at what would have worked and not worked in other states. That's something that came up. These are kind of the types of reports that obviously will be accepted for investigative response, of course, suspicious child death or homicide, sexual abuse, severe physical harm, reports involving child care providers. Alternative response, we're looking more at cases that are like lack of supervision, medical neglect, poor living conditions, educational neglect, and poverty-related cases or situations. Both alternative response and traditional response assess and promote safety, permanency, and well-being, partner with parents, caregivers, communities to connect families with needed supports and services. October 1st, I keep saying 17 days from now, we will be bringing up alternative response in 5 pilot sites across the state. They're Dodge County, Sarpy County, Lancaster, Hall, and Scottsbluff. Alternative response evaluation, because it's tied to our 4A funding, there is a very thorough evaluation process that has to take place for alternative response. And the Center on Children, Families, and the Law will be conducting our evaluation. The pilot is for 5 years, and the evaluation will extend over the full period of the pilot. 50% of all families eligible for AR, so I'm a real visual person, so if you think about all the calls that come into the hotline, and they go through the 21 exclusionary criteria, even if they go through the red team and they're determined to go down the alternative track, 50% of those AR determined cases will go through a computer generated randomizer and will go traditional track. So what that allows us to do is to do an unbiased evaluation system of compare and contrast. Did we get to better outcomes with those families that we worked in an alternative response manner compared to those that we worked in a traditional response? So that's overall goals. Almost all the goals of the evaluation are tied to permanency, safety, and well-being. The evaluation system is fairly complex, but we think it will really help us because there are different stages, really make any necessary adjustments when we see that we may be struggling in some areas. Some areas of the state may be doing it differently and getting to better outcomes. How can we adjust the pilot as we go to get to better outcomes for the families that we're going to be working with in this manner? We have done some projected numbers about how many cases we really wanted to know initially in the pilot sites, and we've actually been gathering data since last July about if alternative response had been in place then, and what cases would have come in and what's the number. Using the exclusionary criteria as we knew it back then, which was a little bit more expanded than even we have now in our 21. I think originally at one point we were up to 27 exclusionary criteria. And what we found when we applied the exclusionary criteria to the cases that were coming into the hotline, on an average in the pilot sites, in Lancaster County, you would see 23 families that we would be working with with an alternative response. Sarpy, you'd have 9, Dodge 3, Scottsbluff 3, Hall County 3, for a total of every month in the state we'll have 45 families that we'll be working with in alternative response. And you can see that would be a yearly average over the year. So we know that this will vary. For example, those of you that are involved in Lancaster County Child Welfare and Juvenile Courts, this week, the last 2 weeks have been incredible. We've had a lot of children come into care. Usually we don't see the bubble. We know what our high peaks are. We usually see a lot of children entering the care, an increase in reports to the hotline in October and April. This year, for whatever reason, it seems like we're kind of almost 2 to 3 weeks ahead. So we're seeing a lot of kids come in. So I know I'm implementing alternative response in October 1st in Lancaster County. I can almost guarantee the families that may be eligible will probably be higher than 23, I would guess. Just because of the sheer volume of the intakes that we've been getting into the hotline. What impact do we want to make with alternative response? Well, really, when I talk to my staff, and they get tired of me talking about alternative response, but these are the families that are right on the doorstep knocking on our door. And what we want to do is we really want to get them to the point where they don't have to knock, that we help them before the knock even gets there. So it's really to decrease maltreatment allegations in the screened-in reports, decrease substantiated maltreatment allegations, increase timeliness and adequacy of service and supports, decrease entries, and we're going to define that as removals, to out-of-home care, improve child and family well-being, enhance the protective factors. Some of you are very familiar with the protective factors. Protective factors are a big part of our model in really helping parents enhance those areas where they need and they identify they need help. Increase worker satisfaction. One of the things that we've seen in our agency over the years, and in child welfare in general, the average retention for worker in this field is 2 years on a national average, which is outrageous, but it's the nature of the beast because of the trauma that everybody experiences that works in this field. One of the things that they've seen in alternative response and differential response when it's been implemented in other states is worker satisfaction is significantly increased, and hence worker retention is also improved. And then more than anything else is we really hope to strengthen partnerships with agencies, providers, and community stakeholders, because we know the sooner we get to families and help them develop support systems, whether they're formal or informal, the less likelihood they are going to end up on our doorstep. Each of the 5 pilot sites is working on, with the community, to develop flexible spending process. And I alluded to this a little bit earlier, to provide families with concrete supports such as food, transportation, shelter. Any of you that have worked with the department for a number of years have probably know that getting paid timely has always been a challenge for the agency. And a lot of times a service or a good has to be provided before we can pay for it. And so we're trying to work with providers in each one of the pilot sites to come up with a flex spending that allows, if we go out and we see that we've got a 7 and a 8-year-old not getting to school on time because mom's car is broken down or she needs new tires, and the kids haven't been to school in the past week because she lives 5 miles out in the country, what can I do immediately to get that family that resource that they need, those new tires, that car repair, whatever it takes. We're working with agencies in each one of the pilot sites to put a mechanism in place where we can purchase those things much more quickly within a 24 to 72 hour turnaround, if not daily, and get them paid. So we're working on setting up that system. Our agency and the communities are working together to connect families with formal and informal supports for sustainability and prevention of future risk. In Lancaster County, for example, many of you may not know, but there is another pilot going on, and there is in a lot of other communities. I know in Dodge there's a similar pilot, but in Lancaster County we have community response that's occurring in our city, and it's really related to families of poverty, but it's really a totally prevention program. And we're really partnering with them because we know we're going to touch the same families, whether it's community response or alternative response. And we also know that the same formal resources and informal resources in the community will be being used by the same families. So we're really trying to partner with them and doing a lot of joint work with them in order to not only expand community response, but to make sure we have adequate resources in our community and buy-in from a lot of entities that we traditionally maybe have not worked with, like our faith-based community and our cultural centers, to really get them on board, to build an infrastructure that can better meet the needs of the families in our city or in our communities. This is kind of our implementation timeline. You can see we're at October right now, so we're just kind of getting on the cusp of getting it started. The pilot site staffs have all been I shouldn't say that. We have one more training. And all the staff, we have one more training. All of our staff have been trained. We've been in the process in the last 2 weeks of really training our hotline staff and our red teams. So we're really gearing up. We've been doing some community presentations to just educate and bring the awareness up that it's rolling out in the next few weeks. Some of you may have received invitations to AR kickoffs in your communities. We highly recommend that you attend if you got an invitation. If you didn't, would like to come, Lancaster County is next Thursday from 3:30 to 5 at our DHHS South location. Send me an email. I can send you the information if you didn't get an invitation and would like to attend. I think Dodge County actually is happening as we speak. I know some of my counterparts are attending that kickoff. I always love being at the end of the day because usually it cuts down on questions. And I felt like I just probably spewed all over you alternative response in one quick, short, fast presentation. But does anybody have any questions? Many of you have been on external stakeholders. Mm-hmm.
Protective factors, you want to just maybe talk about that?
Sure. Protective factors is not new to some of us. Some of us use protective factors in our practices. I know the region uses protective factors. Protective factors are a way we look at parental capacities, basically. And if you asked me to name them off the top of my head, I'm sorry I couldn't. But it's like parent resiliency. Do parents know that when they get into crisis, how do they handle that? It really helps really evaluate what is needed in that home to really reduce the risk and make those kids safe. It's also, for our staff, learning how not to go into the family and say, okay, your protective factor that really needs, enhancing is your parent resiliency. It's really not only teaching our staff about protective factors, but really how do you talk that common language with families and get their buy-in. Protective factors is an evidence-based model that's used across the nation, and like I said, several different disciplines. Mental health field uses them in certain models that they apply. We use them. We're going to be using them. It's my hope, like I said, I've been around the block a few times with the department, but I would really like us to really seriously look at incorporating protective factors in addressing them in some of our non-court and court cases, because I think they are really essential in helping workers identify what needs to occur, what change needs to occur in those families where safety and risk are of concern. So, that answer? Mm-hmm.
So, the alternative response is going to be implemented for 5 years as a pilot program?
It is a pilot for 5 years. We're starting out in these initial counties across the state. The hope is by the end of the 5th year, it will be fully implemented across the state in all counties.
So it'll be starting to implement before the end of the 5 years?
Well, we're starting implementation in these 5 counties first. Then, depending on how it goes, in Center on Children and Family Law, who's doing the evaluation, at key points during the 5 years, they had to provide us feedback. They're required to provide us feedback. With that feedback and with data that we'll be, gathering internally, we'll make a decision about when do we roll it out to the next community or the next county or several counties within each one of our 5 service areas. So the goal is we'll slowly roll it out across the state. So at the end of the 5-year pilot, all the state will be doing alternative response if we're getting to the outcomes that we're hoping to get to. And that's what the evaluation piece will really help drive that decision making. Any other questions, concerns? Pass it off to my Bridges partners. Thank you.